Coronary artery disease and cholesterol. What is the connection? By Diana, Mary, Vivian, Ciara, and Cassandra.
Here are a few facts about heart disease. 9 in 10 Americans don't know the difference between cardiac arrest and heart attack.
60% of Americans confuse symptoms of heart attack and stroke.
Only 49% of Americans know about their heart health.
What is coronary artery disease? Coronary artery disease, also known as CAD, is the buildup of plaque in the arteries of the heart. These plaques, which develop over time, eventually can occlude those vessels that lead to the heart's muscles. As a result, the surrounding cardiac tissue is deprived of oxygen and nutrients. When the tissue is deprived of this oxygen and nutrients that's typically carried in blood, the affected tissues die, resulting in detrimental damage to your heart's ability to pump blood throughout the body. Sometimes this can result in death because when your organs stop receiving blood that is full of the oxygen and the nutrients, they no longer can function. Here in the picture to the left, you see a heart, and there is a zoomed in photo of a coronary artery. It shows the plaque buildup, which can occur in people's coronary arteries. And it's obvious here that this buildup in the arteries can include blood flow.
How does cholesterol contribute to the development of CAD?
The buildup of plaque in the coronary arteries is called atherosclerosis. This plaque, atherosclerosis, is made up of cholesterol, fatty substances, cellular waste products, calcium, and fibrin. Fibrin is a clotting material in the blood.
The type of cholesterol which contributes to the development of plaques in the coronary arteries is called LDL. This LDL cholesterol is sourced from food such as eggs, cheese, red meat, and shellfish. To decrease your risk of developing plaques in the heart's coronary arteries, the consumption of food high in LDL should be minimally consumed.
A good way to remember the difference between good and bad cholesterol is HDL is good, so you want the HDL to be high. HDL begins with an H and high begins with an H. And then LDL is bad. That's the kind of cholesterol that you want to remain low. LDL begins with L and low begins with L. So there you can tell the difference between the two just by remembering that little trick. Here to the left, you see pictures of two vessels. You see how HDL acts in a vessel and how LDL acts in a vessel. You can see that HDL does not form plaques or contribute to plaques in the vessels, while LDL does, which in turn can eventually occlude your blood vessels and the blood flow. Which foods are high in LDL? Commonly consuming foods with high levels of LDL cholesterol puts you at a higher risk for eventually developing the plaques which contribute to coronary artery disease. Some of these foods are commonly consumed, such as eggs, cheese, red meat, shellfish, and etc. It's important to note that though these foods do contain harmful cholesterol LDL, they still can be minimally to moderately consumed, just not excessively. Or you do put yourself at risk for developing the plaques, which will eventually occlude the blood flow to your heart muscle. Here to the left, there's a picture of a man consuming some foods that are high in LDL. Right there, there is alcohol. We have foods that are high in saturated and trans fat. We have sugary foods. We have foods that are refined grains or starchy. And then we have high calorie foods.
Why is it important to educate the community on CAD? According to the CDC, coronary artery disease is the most common form of heart disease in the United States, resulting in 1 in every 4 deaths. It's extremely important to educate the community on the signs and symptoms of CAD because the sooner it's recognized and brought to the attention of healthcare professionals, the more likely it is that the implemented interventions will be successful.
On the right, it shows a heart with coronary arteries that are occluded by a plaque developed by LDL. This plaque, like previously discussed in another slide, is called arteriosclerosis or atherosclerosis. For example, heart attacks are very common in patients with CAD, and the best time to treat a heart attack is within 1 hour of the onset of the first symptoms. Waiting just a couple hours for medical help may limit your treatment options, increase the amount of damage to your heart muscles, and reduce your chance of survival. And for the best chance of salvaging a client's myocardium, which is the muscle of the heart, a thrombolytic agent must be administered within 6 hours after onset of chest pain or other signs or symptoms of a myocardial infarction, otherwise known as a heart attack.
The prevalence of San Joaquin County heart disease. In December of 2020, atherosclerotic heart disease accounted for 5.6% of patient deaths, pitting itself at the position of the second most common causes of death in San Joaquin County. In the graph pictured below, it is discussing heart disease deaths per 100,000 according to race. This graph was done in 2018. As you can see, in San Joaquin County, the highest race is the Black or African Americans. The second most common cause of heart disease deaths were in whites, and then third was Asian or Pacific Islanders. Prevention of coronary artery disease. It is important to have annual blood work to check cholesterol levels, an active lifestyle, such as exercising at least 60 minutes a day, a well-balanced diet, low in LDLs, such as fruits, vegetables, whole grains, and limiting animal fats, controlled blood pressure, an appropriate body mass index for your height, minimal stress, so learning effective coping skills is important, maintaining a blood glucose level between 90 and 100, limiting alcohol consumption to at least only 3 drinks a week, and cessation of tobacco use, so avoiding smoking.
The most common identifiable sign of coronary artery disease is chest pain and discomfort. Chest pain is also known as angina. Angina can feel like pressure, squeezing, burning, or tightness in the chest. The most common signs of coronary artery disease in men is discomfort, tingling in the arms, back, neck, shoulder, and jaw, as well as chest pain and shortness of breath. It is important to note that signs and symptoms of CAD tend to present more vaguely than they do in men. Some signs and symptoms that women should look out for are sudden dizziness, heartburn-like feeling, cold sweats, unusual tiredness, and nausea and vomiting. Timing is crucial, so signs and symptoms should be reported to a healthcare provider immediately. What puts you at risk for developing coronary artery disease? There are 2 groups that categorize risk factors for developing CAD. There are non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors are things that cannot be changed. These include age, gender, family history of cardiovascular disease, ethnicity, and genetics. Males become more at risk at 55 years old, and females become more at risk at 65 years old. You are also more at risk if you have a first-degree relative that has coronary artery disease. African Americans are also more at risk for developing CAD. Modifiable risk factors are things that you can change. These include hypertension, elevated LDL, obesity, inactivity, heavy drinking or smoking, hyperglycemia, and an unhealthy diet. These are modifiable because they are all things that can be changed to lower the risks of developing CAD.
How is coronary artery disease diagnosed? You can expect to undergo these tests inside a hospital setting to help diagnose your medical condition. An electrocardiogram, or ECG, is used to measure the electrical activity, rate, and regularity of the heart. Stickers known as electrodes are placed on certain areas of your chest. This device will measure the heart's conductivity and can help determine any abnormalities. A cardiac echo is a visualization of how your heart's chambers and valves are pumping blood through your heart. A stress test measures your heart rate while you exercise to determine how well your heart is working when it has to pump more blood. A cardiac catheterization checks the inside of your arteries for a blockage by inserting a thin, flexible tube through an artery in either the groin, arm, or neck to reach the heart, in order to check for blood pressure within the heart and the strength of blood flow through the heart, as well as collect blood samples. The first community resource that we would like to discuss is the St. Joseph's Heart Vascular Institute located in Stockton, California. This institute offers cardiac rehabilitation, which involves exercise training, emotional support, and education about lifestyle changes. They also have an advanced heart disease clinic that treats patients with various stages of heart disease, inpatient care where you can receive care inside of the medical center, a cardiac catheterization lab where doctors can diagnose and treat heart conditions, and emergency care for heart attacks. The second community resource is the Pacific Heart and Vascular Medical Group. This medical center has two locations, one in Stockton and one in Lodi. They offer personalized care to accommodate to your individual needs, state-of-the-art testing, which includes echocardiography, stress testing, non-invasive vascular testing, heart monitoring, and more. They offer individualized treatment plans where they can meet with your healthcare provider and your insurance in order to come up with the best treatment plan for your condition. And their goal is aimed to promote overall cardiovascular health and improve quality of life. This concludes our presentation on the connection between coronary artery disease and cholesterol. If you have any further questions, please refer to the American Heart Association. Thank you.